This video was produced in late September 2019 prior to the COVID-19 coronavirus pandemic. Our recommended procedures and protocols did not have to change because we only operate at a high level of safety.
We added an important 2020 update. At the end of this video, we will repost the March 14, 2020 memorandum concerning the U.S. Department of Labor's OSHA temporary enforcement guidance for the enforcing of the Respiratory Protection Standard 29 CFR 1910.134 with regard to supply shortages of N95 filtering face piece respirators due to the COVID-19 outbreak, copied directly from the OSHA website.
The relationship experts have always maintained that safety should always be enforced with a proactive approach. If your safety protocols were not being followed before a devastating incident or event occurred, your relationship with safety was already broken and your environment was not safe. Admit that and do better. There is respirator mask safety information in this video that you may need. Please watch the entire video. The information in this video is the safety relationship experts' interpretation of the regulatory compliance guidelines for safe respirator usage. Be sure that your company's respiratory protection program is in writing and covers your procedures for necessary medical evaluations, pulmonary function testing, respirator inventory, maintenance and disposal, employee education and training, and other details.
During this video, some of the comments will be very harsh because our only concern is worker safety. No excuses, no compromises. We are the safety relationship experts, and you are tuned into another boring safety video series, Respirator Basics. This subject is very simple, but some employees, facilities, and employers attempt to complicate it and often misrepresent the facts. Here are the plain facts. If you have any job where wearing a tight-fitting respirator mask is part of that job, you must pass a respirator fit test. Every year for each style, size, and model number of the respirator mask you would possibly wear during the year. This includes tight-fitting half-face, full-face, dust mask, N95 mask, SCBA, and any other tight-fitting respirator masks. The rule applies to pretty much every job industry. And no, religious beliefs do not exempt anyone from this rule. The rule does not, however, apply to loose-fitting respirators like some PAPR types. And we will not be commenting on any masks made of cloth or general face covering.
There are many different respirator mask types, brands, and styles. We will focus on full and half-face elastomeric masks, which are the rubber-like ones, and half-face filtering face piece masks. An employee cannot wear a respirator as a mandatory part of a job duty unless the employee has passed a respirator fit test, and that fit test is required annually. No one is allowed to participate in a respirator fit test if the hair on the face is in any way between the seal of any respirator mask and the skin.
And no, religious beliefs do not exempt anyone from this rule.
Hair that would exist between the mask's seal and skin must be clean shaven. The respirator mask seal itself cannot be placed on top of hair. The mask can cover hair, but where the mask touches the face must again be clean shaven. This also refers to hair that may break the seal of the forehead portion of a full-face respirator mask. If an occupational health testing provider allows anyone to pass a respirator fit test with the employee's facial hair present between the mask's seal and the skin, that testing provider is endangering your employees and your business. If an employer only enforces the respirator mask shaving protocol on respirator fit testing day and not during normal days when the employee could possibly wear a mask, that employer is endangering the employee and the business.
An organization is possibly causing harm if that organization instructs or advises the use of makeshift respirator masks or employee use of respirator masks that have not been properly tested, or encourages the issuing of masks to employees that have not been trained or fit tested with that particular mask, style, size, and model number. Proper respirator fit testing and training combined takes less than 5 minutes after the initial 5-minute mask comfort assessment.
What is a tight-fitting respirator mask?
Any respirator that requires a tight face and or neck seal in order to function at full capacity.
What is an N95?
This subject confuses most people. There are N95s and there are N95 masks. N95 is a filter designation. The N means not oil resistant. 95 means there is protection against 95% or more of airborne particles. The N95 masks, which are generally filtering facepiece disposable masks, are very popular, but the term N95 can also refer to a filter insert that is used in a reusable mask or used in the replaceable cartridge of a rubber-like or elastomeric respirator mask. These reusable masks can also use other filters like the P100, which actually offers more than 99% protection against airborne and oil-based particles. The most common N95 mask mistake is the assumption that only one style of disposable mask is an N95 mask. Keep in mind, what we call paper masks are usually electrostatically charged complex designs comprised of plastic. There is much more to it than a paper towel or a piece of plastic and a rubber band. N95 filtering facepiece masks come in many shapes, styles, and colors. They are all different masks that happen to have the N95 designation. You must be annually fit tested with each size, style, and model number of N95 masks that you might wear at any given time. Since filtering facepiece N95 masks are not generally shareable or reusable, the most common question concerning the N95 mask is,
when or how often do I dispose of it?
Well, that question has to be answered by your company's written safety protocols or the mask manufacturer. Our common sense opinion is, after the mask is exposed to a contaminant, and the mask should be worn during any time period where you are exposed. Employers and manufacturers can also answer questions related to how many hours you should wear the mask at one time. Also, refer to your safety protocols or manufacturers for important reusable mask information like filters, cartridges, mask cleaning, and maintenance questions. No matter what job industry or situation, wearing a respirator mask affects you and those around you. So be informed and educated on this crucial part of your PPE. We will cover brief basics about qualitative and quantitative respirator fit testing. The employees should wear whatever work gear they would wear during regular respirator usage. The mask should be worn for 5 minutes before testing begins to confirm the fit, comfort, and seal, making sure that the support bands are in place. For example, most masks with 2 bands are worn with one band above your ears and near the crown of your head in a stable position, and the other band below your ears across the back of your neck. The most common qualitative fit testing involves a hood, your respirator, and a harmless aerosol, tasting, or smelling agent used only for testing purposes. This test relies on responses from the employee being tested. Qualitative fit testing is used for half-face mask styles and some powered air purifying respirators, also called PAPR or PAPR, but not recommended for full-face masks. The common quantitative fit testing involves a particulate counting digital device connected to an adapter that is attached to your respirator as it registers particulates inside and outside of the mask. Quantitative fit testing is used for both half-face and full-face masks. As of September 2019, both fit testing methods utilize 2.5-minute testing exercise procedures. Full and half-face elastomeric mask, rubber-like mask. 50 seconds bending over, 30 seconds jogging in place, 30 seconds head side to side, 30 seconds head up and down. Filtering facepiece masks, like the paper types. 50 seconds bending over, 30 seconds talking, 30 seconds head side to side, 30 seconds head up and down. Okay, those are the respirator safety basics. Now you can view the memorandum we mentioned.
Thanks for watching.